The other families of arboviruses that we'll talk about are the Bunyaviruses and Arenaviruses. These are enveloped negative sense strand RNA viruses. They have similar replication to all of the other negative sense strand RNA viruses. They can both be zoonotic infections. Generally, only the Bunyaviruses are technically arboviruses, but they do kind of get lumped in together because they cause very similar symptoms. They mostly cause encephalitis or hemorrhagic disease, just like our alpha and flaviviruses. So with the Bunyaviruses, most of them are arboviruses, with the exception of Hantavirus, or the Hantaviruses. So on this chart, you can see some of the different Bunyaviruses, things like California encephalitis virus, Rift Valley fever, Crimean Congo hemorrhagic fever. A couple that I want to point out that you might start hearing about more in the future are things like lacrosse virus, that's here in the US, and the Heartland virus, which is also in the US. So they're not common yet. We don't know a lot about them, but they're starting to become more common. With the hantaviruses, what we see is that infection is acquired through the inhalation of aerosolized urine, so rodent urine. And it can cause hemorrhage of the lungs and then lethal pulmonary disease. So really the only one of the Bunyaviruses we're going to talk about is the sin nombre virus. So right here, those of you who speak Spanish, you might recognize that it basically means the no-name virus. And I'll tell you why it is a no-name virus in just a minute. So with the Bunyaviruses, the majority of Bunyaviruses are acquired from an arthropod bite. For Hantaviruses, it's from rodent urine. As always, we have those initial flu-like symptoms, and it's that secondary viremia as the virus goes back into the bloodstream that allows for access to the specific target tissue. Could be the central nervous system, could be organs like the lungs, it could be the vasculature that causes hemorrhage, so like Crimean Congo hemorrhagic fever. Antibody is important in controlling viremia, but of course, interferon is going to cause those flu-like symptoms, but also be important as that initial response to the infection. And then cell-mediated immunity can help prevent the infection from getting even worse, but on the other hand, could also contribute to disease. And so when we see Bunyaviruses and how they're transmitted, especially our arthropod-borne Bunyaviruses, we're looking at a cycle between, some sort of usually mammal. On the previous slide, you can go back and see which mammals, but sometimes it can be domestic mammals too, like sheep or cattle, and humans. The other thing that they're pointing out on this slide is what's called trans-ovarial transmission. And this basically means that if the female mosquito is infected, when she lays her eggs, all of the larvae, and therefore the new mosquitoes that in this next generation, will also be infected. Okay, so Hantavirus is really the only one we're going to talk about in just a little bit of detail. And Hantavirus, we're going to talk about it because it can be found in the United States. So this is a map that spans 1993 to 2020, so like 27 years of the cumulative hantavirus cases. So these are they're noted in the area where the patient showed up to be treated. So there was like one patient in Maine. Did the patient get hantavirus in Maine? Probably not. But where they show up for treatment is kind of where they get diagnosed. And so what we're looking at here, hantavirus is actually most common in this region of the country called the Four Corners. because Utah, Colorado, New Mexico, and Arizona all share a border, right? Like this corner here, there's 4 states. So the virus was originally called the Four Corners virus. But also really common in these areas are reservations for some of the Native American tribes that have historically inhabited the area. And they were really upset about the virus being named after their region. And so that's why the virus then became the sin nombre virus. It's a no-name virus because they didn't want it to be called the Four Corners virus because it made a negative connotation. So that happens sometimes with viruses or disease names. If they're named after a place or something like that, it may be changed to eliminate some of those negative connotations. But you see, we do have hantavirus in the US. And every year there are cases of hantavirus. And there's a, decent mortality rate. Anywhere from like 25 to 50% of patients who get it may die. And these are just some headlines I pulled from different parts of the country, but Reno, Central Oregon, Arizona, New Mexico, California. So not uncommon. And what our symptoms are going to be, if we go back to this slide here, generally we're looking for pulmonary symptoms. You're going to have difficulty breathing, but it can develop into shock and pulmonary edema. So that hemorrhaging in the lungs and fluid buildup in the lungs that can cause death of the patient. There is another hantavirus that's found in East Asia that can incorporate renal syndrome, so kidney issues. In the US, it tends to be totally pulmonary. So patients with Bunyaviruses can be diagnosed by reverse transcription PCR, can be confirmed by serology. Unfortunately, there is no real treatment. So the idea would be prevention of contact with vectors. In the US, you want to keep rodents out of your area. That's where the majority of patients who are going to be infected are going to be infected because there were rodents in the area where maybe they were camping or staying in a cabin or something like that. So this is a case of hantavirus in Virginia. The CDC reported a case of hantavirus in a 32-year-old wildlife sciences graduate student. The patient visited the ER in Virginia after experiencing fever, cough, and a sore chest. The student had been trapping, handling, and studying mice during the previous month. Neither he nor his colleagues wore gloves while handling the mice or their excreta, so their feces or urine. They did not wash before eating and had numerous mouse bites on their hands. This is a total failure here. He had a fever of 39.3, normal lung function, but a chest x-ray indicated some pneumonia on the right side. He started vomiting in the ER and was admitted. The pneumonia progressed. He became hypoxic, required intubation and ventilation. On the next day, he was given activated protein C to prevent disseminated intravascular coagulation. He continued to fail and died on the 3rd day after hospitalization. Serum specimens contained antibodies and genomic RNA determined by RT-PCR to hantavirus. Viral antigens were also present in the spleen. Although the virus received its greatest notoriety with the sin nombre virus outbreak in the southwestern US in 1993, it can occur wherever people come into contact with urine and feces of rodents carrying these viruses. Cases have been reported in 31 of the states. Just very briefly, I wanted to tell you about a couple of the arenaviruses, the scary ones. So some of the arenaviruses are things like Lassa fever and other hemorrhagic fevers. Of course, these would only be worked with under biosafety level 4 conditions. If you are practicing medicine in the US, it is very unlikely you would ever see something like this. But if you end up practicing in other countries, it's possible. Lassa fever specifically is found in West Africa, but some of the other arenaviruses that cause hemorrhagic fevers can be found in South America. So Lassa fever clinical study, very short. 10 days after returning from a trip to visit family in Nigeria, a 47-year-old man developed flu-like symptoms with a higher than expected fever and tiredness. The disease got progressively worse. After 3 days, the patient developed abdominal pain, nausea, vomiting, diarrhea, sore throat, bleeding gums, and began vomiting blood. He developed shock and then died. So again, those of you who are planning to practice in the US, this is almost certainly the only way you would ever see a hemorrhagic fever, is if a patient who was returning from another country where a hemorrhagic fever viruses are endemic came back to the US. Otherwise, it would be very, very rare.